To illustrate that, I want to show you a quick extract of an interview of a CEO, and I want you to react, but I'll pause regularly to talk about some things that can be seen in the rhetoric, which includes how the journalist addresses the CEO.
We're out here in San Francisco this week because we want to dive right into the heartland of American innovation. And that often means going off the tape to talk to game-changing privately held companies that are leading the way in their particular industries. Which brings me to Theranos, a revolutionary diagnostics company that empowers individuals to take better control of their own bodies while at the same time upending the existing paradigm that's costly, inefficient, and painful for the client, namely you. This is a revolutionary company that threatens to change healthcare the same way that Amazon changed retail, or Intel and Microsoft changed computing, or Apple, yes, changed the cell phone. It could be that huge. And you might be checking it out yourself at a Walgreens near you, as the gigantic worldwide drugstore chain has adopted Theranos' solutions. Could this be the future of preventive medicine? Let's take a closer look with Elizabeth Holmes. She's the founder and CEO of Theranos, who also happens to be the youngest self-made female billionaire in America. Ms. Holmes, welcome to Mad Money.
So before we even listen to her, that journalist already told us so many things. So we are not coming to what she's about to say in a neutral manner at all. He said twice that it's a revolutionary company. He said that it's upended challenging the status quo that is costly and inefficient. So there's a problematic situation that is being addressed. He is, in the end, only starting to phrase it as a question. Is it the future of diagnostic medicine? But all the way before, it was very strong statements that were legitimizing what we're about to listen to. So it frames things. If the guy annoys you, or if you're profoundly anti-Silicon Valley, maybe it's going to have a rejecting effect, but it has a framing effect on what we're about to hear. She's the youngest female self-made billionaire. It's a very complex sentence that could need to be unpacked a little bit, because when someone tells you their wealth, the question is it cash in the bank or is it something else? And as it turns out, for Elizabeth Holmes, she's only a billionaire because her company is valued at a certain level and she owes parts of the company. But if the company were to go bankrupt, she would not be a billionaire anymore very, very fast. So, see, it goes very, very quickly, but although we don't have the time to listen to everything and unpack everything, it frames the way that we're seeing. She's a very successful person. She's a woman. She's a self-made billionaire, so she's not inheriting any kind of a thing. She started a revolutionary company that could revolutionize the entire sector, and that sector is inefficient and costly. And is building even on our frustration, saying, naming you, the viewer. So there is a framing already of enthusiasm about Elizabeth Holmes. So let's listen to her.
Thank you. It's great to be here.
Thank you. All right, Elizabeth, you're doing something that's so profound that you're giving transparency. You're also making it so that it's easier, better for the consumer. There's a little device that you have that I think is the good metaphor to start with. Could you show us and tell us what it is?
Absolutely. So this is what we call the nanotainer,
Okay.
which is a very small tube that's designed to replace the big vials that you take out of your arm when you draw blood traditionally, with a tiny drop that can come from a finger.
Okay, so what does this mean for the traditional way we do diagnosis, and how would it upend the paradigm? Because I know you don't want to think small.
The goal is to empower the individual. We believe strongly that the future of healthcare is in enabling the individual to have the information that they need to take ownership of their health, and making lab information, which drives 80% of clinical decisions, more accessible by making it as painless as possible, making it incredibly inexpensive, and providing transparency around pricing so that people know before they buy a healthcare service, how much it's going to cost them, we can begin to make it possible to enfranchise the individual and get them engaged.
Now, this is not some pie.
What did she say?
Apply it to French people,
Yeah.
and it's more cost effective than the existed products.
Yeah. It's cheaper. By how much?
I didn't get that information.
80%.
80% is the only number that she gives, but it's about how information is used in the healthcare system.
She never says it.
She never says it. How does it work? She never says either. She's not going to divulge trade secrets on, but we have very little insight as to how does it work. What's the name of their little vial that they're... Nanotainer. What do you think about the name? Do you like it? Do you... Is it a nanoliter? Is it a nanometer? No. It's more likely a milliliter and a millimeter. But nano is very, very smart. It evokes really, really small things. Apple had a nano version of its iPod at some point that was not a nanometer either, but it's a smart way of phrasing it. She uses words very often. Have you noticed a couple of words that come back several times? They want to empower patients. What does that mean? What does the company do? What do you understand is the activity of the company?
I think the main idea was that you can draw blood maybe at home, and that you have control over your data that you want to find out to make smarter decisions about your health.
How I can today have a syringe at home, so I could take my blood at home. Here it seems to be easier. Why?
Because like you can draw it from like your fingertips, so I assume that it's easily applicable. That you don't need like knowledge about the veins and the disinfection and the material that probably is also costly. So I assume that they must have a way to make it like easy.
It seems that there's an easier way to draw blood on a smaller amount, and maybe I could do it at home, or it would be more readily accessible. Is it a good thing?
For Americans, yes.
Why?
Because healthcare is ridiculously expensive there, unlike it is here in Canada. It's empowering the consumers is definitely a smart play in the healthcare industry, just because it's so controlled by public and private healthcare. If you need something done quick, you would likely have to go to private healthcare and pay even more. So if you're able to do it on your own time and in your own space at a cheap cost, it's a strong business model.
Yeah. So diagnostics, or at least doing a blood test more easily, would address a big need in the sector. And that's where the frame becomes very powerful. She doesn't tell us anything about the product, the technology. She's telling us how it addresses a major problem, both at the political level and the individual level in the healthcare system, in the US particularly. But it's a dangerous thing, because if she plays on the frustrations, the deep frustration, and it's a deep-rooted, recurring issue in American society, healthcare in general, she's playing a tune that everyone wants to hear. Because if you're struggling to pay medical bills because of blood that was drawn that was more expensive, and then everything else was expensive, nothing to do with the blood, but you're taking all these frustrations and you're channeling them to build a positive image of yourself. And that's where rhetoric becomes powerful. She's not talking about evidence. She's not talking about facts. She gives barely any figures. But she frames things in a way that she takes all the audience's frustration and she channels them toward a solution that she's carrying. How can you be against that? How can you be against someone who's saying, I'm going to make healthcare faster, cheaper, more efficient?
When it comes to like drawing, like I think explaining in terms of numbers would confuse a lot of viewers. So that's not something that she would be likely to mention, and also those who would listen to it would likely push for proof. So there's no point of saying numbers.
But you said two things that are very important. A, you would lose part of the audience by giving more evidence and facts. So that says a lot about the audience or how the audience is treated. Meaning what I'm leveraging is your emotions. That's what I'm tapping into. I'm not leveraging your reasoning. The second thing that you said that's very important, if she were to leverage the reasoning, there would be questions. So she's doing two things at the same time. She's tapping into emotions, what Aristotle identified as pathos, and she's pushing in the background as far as possible the reasoning, the logos, which is another lever identified by Aristotle. So she's trying to move away from that, and she's going to go even a bit further.
In the sky, first we got a great board of directors, we all know that, but Walgreens Boots, that's the largest. They have decided that your way is the way to go.
We are in 41 wellness centers in Arizona. We've been able to serve a huge number of people over the course of the last year, and it has been phenomenal to see what it means for people to begin being able to afford the ability to do a test when they haven't been able to do that before, and being able to do it in a location that's convenient. For example, being able to come in on a weekend to get tested as opposed to having to go to an emergency room, which was the alternative before.
Now, if people know that they have to get stuck, it's something you've described it as like spiders. There's certain phobias. Having a needle in your arm is something that has kept people from taking care of themselves, right?
Absolutely, myself included. I'm absolutely terrified of it. And I mean, I've always said if you were to sort of think of torture experiments, it would be a phenomenal one, because you sit there and sort of watch as your blood is sucked out of you. And it's incredibly painful for cancer patients who go through hell with all the blood that they have to get drawn, or little kids. We've had a phenomenal experience working with mothers of autistic children who resonate so strongly with this, because otherwise when they take a child to get their blood drawn, they literally have to strap the child into a chair.
Well, there's an...
The issue with critical thinking is that it can make us cynical. And when someone says we want to close the poor, help the, might be like, what are your true intentions? So it's a fine line to be critical and not to become cynical. But one has to acknowledge that the list of examples that she gave are incredibly manipulative. How can you be against helping cancer patients, kids, and people suffering from autism and their parents? Yeah.
I thought it was very interesting because at the beginning she was phrasing that it's a problem that we are all having. So her target audience was like basically the whole world, and suddenly she's talking about very individual targeted like users who had been really responsive in Arizona, which is like one state. So I found like, yeah, it just became so much smaller, and I mean, for her.
And she navigated it very smartly. She went into that limitation, but also all of a sudden, okay, 41 centers in Arizona. I can fact check that. I can go in to see if it's actually true. To what about cancer patients? And what about autistic children? And what about their mother? And here it becomes speculative again and incredibly manipulative, because it, again, taps into emotions. In the little detour before, she did what we talk about, we could call a legitimization trick. She talks about a partnership that they have with a major chain in the US with Walgreens. So all of that is, and the journalists phrase it, oh, they think that your way is the way to go. So again, the questions are incredibly framing, saying this massive company that everyone knows and everyone goes to shop there from time to time, they think that your way is the way to go. Therefore, giving you legitimacy. Right? It's a legitimacy game. You'll see it when politicians do a bit of name dropping of other politicians abroad. They're going to mention that they met Hillary Clinton or Barack Obama. They're going to mention that they met Tony Blair, or they're going to mention, just like name dropping a bit and gaining a bit of legitimacy from that connection, even though it doesn't bring anything to the table necessarily. You'll see it also, and in organization studies, it's a big field where you're gonna bring in some consultants from a big firm that's going to help you legitimize yourself because you're bringing them from a big firm that everyone uses. Therefore, it's bringing some of their legitimacy to you. We work with the consultant of so-and-so and came up with a plan. Difficult to challenge that if the consulting company is very famous and very legitimate in the field. Even if their conclusions are very generic and not very helpful, by the mere connection to that, you're gaining legitimacy. It's called in organization studies isomorphism. It's taking the same shape, isomorphism, as the others to gain legitimacy. Not necessarily be more efficient, but gain more legitimacy. It makes people tend to do the same thing in order to look more recognizable, more legitimate. What do you think about her as a speaker, as someone during an interview, and as a CEO? Do you find her convincing? She can be manipulative and convincing. It goes together. You can find her manipulative and still trust her and her company. Would you go work there? Would you invest? What do you think about Elizabeth Holmes?
I think during the interview she creates this relatable personality. That she's like saying, I'm afraid of like these big needles too, and you kind of feel like, yeah, you do that too, so that must be good. So that your solution should be my solution as well. So she's very likable in the interview.
Yeah, likable. Do you find her convincing, or did what I outlined make you suspicious? Or because we could do it about anyone, so. It's a difficult thing of separating being critical and being cynical. Yeah.
If I was an old person living in the US struggling with healthcare and I don't have health insurance and I make all these payments and I don't have much money, so yeah, I'd be super convinced by it.
Let's make it an old person in Arizona. Are you trying to look up one of the 41 locations to go get your blood drawn?
Straight away.
She's lying about everything. They are not in 41 Walgreens. Walgreens is still suing her and suing the company for lying, deception. The nanotainer was never operational. The legal team forbade Theranos to call it a nanotainer because it was manipulative in its advertisement, and that's why it's called Theranos sample on the advertisement that was seen. She was, based on company valuation, the youngest self-made female billionaire, and she's now bankrupt and facing prison charges. There was a trial that finished a year and a half ago. It's a bit long because there were some elements that changed. None of what she's saying is true. They were never able to draw blood and make diagnostics on one single drop because it's physically and medically impossible.
When did the interview take place? Was it like before all
Yeah.
the
Yeah. That guy is not
he's so biased. Like
he's still on TV and he's still making investment recommendation, and he's still one of the most followed show on US TV about the stock market and companies. So, but we will see in the studying the financial crisis of 2007 that all the companies that were involved are still existing today. The people that were leading the banks are still leading the banks today. And the people who were working around them, like the rating agencies that said that the financial product that were catastrophic in 2005, 2006, 2007, that were full of crap, worth nothing, they were giving it the AAA highest rating. All these rating agencies are still operating today, and they have no competitors. The idea that the markets operate efficiently is an illusion. It's true sometimes, it's wrong sometimes. The idea that it's always wrong or always right derives from specific ideologies. But Elizabeth Holmes is starting a new company, and he's still interviewing entrepreneurs in his show and granting them with the same kind of manipulative framing. Yeah.
Where, I mean, you might, I don't know if you can get into this right now, but like, did she have fraudulent financials? Like, how do you get valued at over $1 billion when she doesn't have those locations? Like, where does that come from?
Rhetoric.
So she wasn't a self-made billionaire?
She was, because she was owning a massive stake in a company that people valuated at billions of dollars.
That was private.
Yeah. But the same way that Elon Musk is not a billionaire, he's only a billionaire on paper, because most of his wealth is in investment. And the net, concrete, liquid wealth of Bernard Arnault, which is very often also the richest man in the world, is not in the billions. It's impossible to have a concrete wealth of billions. Do you understand what that means, to have billions in concrete value, not in market valuation, but just even in real estate? The quantity of things you need to own in order to be a billionaire just in real estate and estate.
But if I was getting down that track. It's like, if those 41 locations weren't real,
Yeah.
and she, had fraudulent infrastructure, like, where was this billion valuation coming from?
The rounds of investment, including Walgreen, who was scared for their life in terms of market position, who saw localized diagnostic medicine as one of the ways. Can you imagine if it does work? Your chain that hosts the Theranos Wellness Center becomes the focal point of healthcare in the US overnight. So if it's true, it's okay. So they invested, I think, 430 million in the company. So if you invest 400 million in exchange of 5% of the company, what's the valuation of the company? You invest, I'm making the numbers confusing on purpose. Yeah? 8 billion.
Yeah.
And if she owns 80% of it, she's a billionaire. Just because a journalist says that she's a self-made billionaire doesn't mean that she actually has billion in the bank. We'll talk about the production of numbers and how to deconstruct the numbers in another session. What I want to illustrate is how important rhetoric is in so many situations, and how it can draw our attention, our affects and emotions, and leverage them, sometimes against our own reasoning, but also our own interest.